Hello everyone, happy Friday. Just here to give you an update. Um, I feel kind of crappy at the moment, so I'm hoping I can make this fairly quick and update everything. Um, so I saw my oncologist first today, which I have to do every cycle just to touch base, see how I'm doing, see if there's things that need to be changed with the dosages or medications. I also have to have blood work run a couple of days before each cycle. They check magnesium levels, they do a CBC, a CMP, so it's pretty standard stuff. My blood work all came back good, which is a good thing. You know, everything was within limits and with normal limits and all that good stuff. We talked about the Foundation 1 report that came back this week. Foundation does genetic testing on, actually, it's genome testing on the tumor sample. And they look for genes that hamper, like if the gene is mutated and it affects the immune system and things like that. So I do have a gene that's mutated, and I forget the name of it. It's like PLBR1 or something like that. I'll look for it and I'll post it in the description of the blog. But that particular one, basically, come on, Loki. Oh, he's got to be everywhere. That particular gene makes it so that my body basically does not recognize cancer to fight it. So we're going to continue with the chemo to get the the tumor shrunk, and then if there's another recurrence, I think it's going to be if there's another recurrence that we're going to use immunotherapy, which would include like Keytruda. You probably have seen all the commercials for that. So we'll see what happens. I thought he said they were going to do a scan after my second cycle, which this is my second cycle now. So that would be in like 3 weeks, but he didn't mention it. All he put orders in for was the blood work. So I'm not sure if he's going to do it after the second or the third round. I guess we'll see. What else? He updated my letter for the accommodations with employee health. I have put in a request to only be put on one-to-ones during the course of the treatment. There's a lot of reasons, but the reason it was put in the letter was because of the potential for walking to lead to and exacerbate this hand-foot syndrome that's a side effect of the Zolota pill that I take. And it's hand and foot syndrome. It's not the same thing as that hand, foot, and mouth disease. So what happens basically is if you're walking a lot, rubbing your hands together a lot, pressing on things with your hands, like if you're cutting with a knife, it actually can break the capillaries in the palms of your hands and soles of your feet, and the chemo can leak out through the skin and affect the skin, causing like rashes, blisters, dryness, flakiness. It's pretty nasty and apparently can be fairly painful too. So he put down to just put me on one-to-ones through the course of the treatment because of the potential for walking to lead to and exacerbate this side effect. Not everybody gets the side effect, but I don't want to be one that does. So far, I mean, my hands are always fairly dry. So far, I've been okay, but I'm just afraid that on a night when I'm the only tech and I have to be literally running up and down the halls, and every single room that I'm going in and out of, I'm hand sanitizing, I'm putting gloves on. I mean, just for vitals alone. Now, granted, the nurses will help out with some of the rooms, but if I'm doing all the rooms on my own, 3 sets of 4-hour vitals, right? 7, 11, yeah, 7, 11, and 4, yes. at 30 rooms is 120 times in one shift just for doing vitals, going in and out of the rooms, putting gloves on, donning, doffing, hand sanitizing, plus washing the hands a bunch of times in between all that too, can definitely lead to irritation. So I would venture to say that I have a higher risk of it than maybe somebody who has a desk job and is sitting and, typing on the computer. So I had a meeting with employee health, and I'm really not a huge fan of the employee health doctor, and apparently not many people are, including my oncologist who had to deal with him. He was just out for a couple of weeks for some, I don't know the ins and outs of it, but he had to have a couple surgeries and things. So I'm just glad he's back because he's really wonderful, Dr. Lash. He's just fantastic. So the doctor had said to put me on work that is seated only, like sitting down, seated only work. And as a tech, the only thing that's really seated only, and it's not 100% seated only, is one-to-ones. I'm comfortable doing the one-to-ones. I'm in the room sitting most of the night. Yeah, I have to get up and watch them when they go into the bathroom, or if they want to walk the halls, I'm with them, things like that. But most of the night I'm sitting. I only have to wash my hands, sanitize, whatever, maybe a dozen times versus 120 plus. Same with putting the gloves off and on. You know, um, it's just a better environment, better situation. So the doctor, the other thing that was missing was an end date on that, as far as when the treatment's over and I can resume regular duties. So he put the date on that as September 1st because we want to go through all the cycles, make sure that everything's working, and then have some time after to let any continued side effects kind of wear off. So, because a lot of stuff can keep going for a while afterwards. What else did we talk about? I talked to him about the jaw pain I was having. Last the last infusion that I had, the first one, when I left the infusion center and went out to my car, I had a bag in there with me with like a jacket and my phone charger and some snacks and things like that. So I had a banana in there, and I decided I wanted to eat it when I got out to the car. It wasn't. I think I mentioned before that I have to stay away from eating and drinking cold things and touching cold things. So this banana wasn't cold. It was, it's a little chilly in the hospital, generally. So I mean, it was technically room temperature, but it wasn't like warm either. So I took a bite of it, and as I started to chew it, I got this horrible, excruciating pain in my jaw, like up in here, like really, really painful. And it was only really for the first bite, like as I chewed the first bite, and then it was fine after that. It was very, very strange. So that, oh well, maybe the banana was colder than I thought. And then as the days went on, everything I ate, no matter what it was, if it was warmed up, room temp, I didn't eat or drink anything cold, but anything that was, I was still getting that horrible jaw pain on the first bite. And then after that, it was fine. So I had called, because it says right on the literature I got from the oncology office, from my teaching session, it says right on there that if you experience jaw pain, to call immediately and let them know. So it just happened to be about 2 in the morning when I happened to see this on the list of side effects and what to call them for. And, yeah, 2:30 in the morning is late, and I have to deal with on call and whatever. It's lunchtime for me. And when I saw where it said to call right away, I thought I better do this, because if I shouldn't be taking these pills, if it's doing something to me that's really bad, then I need to know that. So the on-call calls me back, and I'm explaining to her what's going on. And she says, I've never heard of a side effect or symptom like that. She's like, it sounds like there's just something wrong with your mouth, with your teeth. You should schedule an appointment with the dentist. I literally hung up on her because I knew this was not a dental situation. Like, I knew it wasn't. It happened immediately after my treatment. So I was like, all right, we'll wait it out and we'll see what happens after the next one. So this lasted for probably about 5, 6 days before it went away. So I mean, it was frustrating. It wasn't like, oh my god, I can never eat. I have to like drink Ensure shakes or something like that. Like, I could eat, but it was just that first bite that was pain like I've never experienced. So today I had the infusion, and then afterwards, we'll go into that. I was at my brother's house, and I went to eat a banana again, and it was the same thing. And then I had a little like granola cookie thing that I went to eat too. Same thing with that. This awful, awful, horrible jaw pain. And then after that first bite was done, it went away. So he said that I guess the chemo can reduce your magnesium, and that can lead to these. I guess it's like a muscle spasm that's happening in that area. So, and he was aware of it, and he could. He didn't give me anything to like deal with it, which again, not a huge problem because it does go away, but not anything that's worrisome, I guess. What else did I talk about with him? We talked about the foundation testing. We talked about one of the things that he had mentioned is that if it were to be dealt with surgically, because I've already had the anterior, I forget what he called it, not a resection. I don't know, the anterior surgery though. He said that with how everything is now, this one would be posterior. And I think I mentioned before too that it was going to include, urology since they were with the original tumor. Let's see, urology, rectal, colorectal, plastics, gynecologic oncology. There was going to be a whole bunch of different services that were going to be involved in this one surgery. So when he said about the posterior and doing, having I think I mentioned too about all those doctors and the so, and then he said something about, what kind of quality of life are you going to have then? So I'm pretty sure he was leading up to the potential for that to become a colostomy. If they had, I mean, depending on where they had to cut and move things, and I don't know. So I'm really hoping that doesn't happen. I don't want to be a double bagger. One is bad enough. It's enough work. It's enough stress. It's enough everything. So, and I told him about the anxiety that I've been having, and it's not anxiety that's being caused by the medications. It's anxiety that's being caused by the diagnosis, the treatment, the side effects, all that I'm dealing with, and then all the nonsense that's going on at work. It's just too much for anybody to take. And he's very understanding about things like that. Like, he knows, he's smart, he knows what he's talking about, but he's also got a good bedside manner, and he can be very comforting when you're having these kind of worrisome episodes. All right, so I go down for the infusion. They got me all settled in, gave me put the IV in. They did it in the right arm again. I think you can see, yeah, you can see a little spot there where it was. That's about where it was the last time too, maybe a little lower on the arm, but maybe 40 minutes into it, my arm just was in so much pain, and there was so much tingling going on, and there's really nothing they can do. That's what the medication does to your body. So they gave me a warm compress, a warm blanket to wrap around it, and that does help. So it made it a little bit better. I got up and went to the bathroom with no problems, got back to the chair, everything was fine. I did have I'd had a ginger ale, which I asked for just a little bit of ice, like right at the start of the session, figuring like as the infusion went on, the ice would melt, so it would get a little warmer. And it was still pretty cold. So as I got further into the treatment, I did go to take a sip, and that cold, I could feel the pins and needles like all in the back of my throat, and it was just weird, just very, very weird. When we were finished with the infusion, the nurse came over and took out the IV, put on a bandage over it, and she was at the computer, entering, I think my vitals, and she asked me something. I don't remember what she asked me. She might have asked me like how I felt or something like that, and I couldn't get more than like half a word out, and I'd have to like stop. And as I'm stopping in between, I'm like, you know, and it was really scary. Before I know it, there's 10 nurses surrounding me, jab me with the EpiPen, and my leg still feels weird from that. It's numb on the one side and it's sore where the needle went in. It didn't hurt when they were doing it. I've never had an EpiPen before, so it didn't actually hurt while it was being done. But now it's a little sore at the site and numb on the left side of my left leg, just at the around that area on the thigh. So we got the EpiPen. They gave me 50 milligrams of Benadryl. They gave me another steroid and Pepsid, which is also a antihistamine. And they said that I looked terrible. I don't know what I looked like. I don't know if I was pale. I don't know. Like it was definitely one of the weirdest and scariest experiences I've ever had. And it took a while. Like I did start feeling a little better right away, but till I felt 100%, not even 100%, till I felt like I could walk and talk with and be able to breathe was a few minutes. So it was, that few minutes seemed like a very long time. So they got me all better. My O2 levels were good. My heart rate was up because of the epi. I had some really bad shakes. They told me that I needed to call somebody to pick me up because of that episode and the Benadryl and everything else. They didn't want me driving, so I'm trying to text people to come get me, to see who's available. It's like 2:30 in the afternoon. People are still at work. Brian was still asleep, so I tried to reach out to the people that I knew were home just to see. I know the couple of them work from home. I tried my niece who just finished college, so I was hoping that maybe she had a little free time on her hands. So the first one to get back to me was my sister-in-law, Heather, and she works from home, so she was able to come and get me, take me back to their house, and then she said that when my brother Jay got home, to have him run me home to my house, which is an hour away. So of course now I'm feeling guilty about having to have someone drive me an hour. So I went back to their place, sat there for maybe about an hour and a half, 2 hours. Was feeling a lot better. Still, I mentioned that I had the weird jaw pain and everything from the banana, but again, that passes quickly. Still having the tingling, like my whole arm, like the site is, where's it at? Here. But like I'm feeling a lot of stuff like in this area. And like up my arm and like kind of back here. So, and my fingers are, and my toes, the numbness, the tingling, it's coming and going, pins and needles feeling. But other than that, like consciously, I felt okay and I was breathing okay and talking okay. So at that point, I just had my brother drive me back over to the hospital and picked up my car and drove home, and everything was fine. Still feeling some of these weird things. I have to use my straw when I drink, because if I'm gulping, like even though it's not like cold, it still like hits more of the throat and gives you that pins and needles feeling. So using my straw for a few days at least. I'm very tired. I've just been tired. It could be the stress, it could be the medications. I don't know. I'm tired all the time. I had a couple of days where I slept like 16 hours, and then a couple of days where I barely slept at all. So it's just all over the place. You know, and of course it's all affecting my moods, and I shouldn't say it's only affecting my moods. No, it is affecting them in more places. Yeah, a lot of anger, or it gets. I think it's the anxiety, and the anxiety comes out as anger, and I hate that I do that, and I'm really making an effort not to do it, which is very hard to do. You've got to be very mindful of what's going on, and a lot of times I catch myself, and I'll stop myself, be like, okay, you know, just take a minute. This isn't that big of a deal. You're gonna get through it. I have to use all these techniques to get through these stressful moments, and the ones I just can't push through are the ones that work. I just start thinking about it, and I get like this. So I do have a conversation going with the director on BH to see about possibly moving back over there. I know they have some open positions, so I want to see what they have, and if there's something that works with my schedule that I can get in there and do it. So kind of waiting to hear back from her. I did hear back from her. She does want to set up like a phone call, but I haven't heard of anything about scheduling that. So yeah, working on that, working on the anger and the anxiety. I think that's it. Talked about the treatment, talked about the side effects. Really I haven't had any vomiting, very minimal nausea. As long as I eat something with the Zolota pills, it's okay. I did have at the very beginning, I had like a very low appetite, but unfortunately that's not one of the side effects. I lost about 4 pounds, like nothing, but just trying to be more cautious of what I eat and try to eat more healthy and try to stay away from the sugar, because cancer loves sugar. So just working on those things. So yeah, so they walked me out to the car, went back to Jan Headers, got my car, came home. I think that's pretty much it. Another long video. I'm sorry. I try to talk fast and keep these short, but there's just so much going on with this and so much going on with me that it's hard to keep it concise. Plus I a lot because I can't remember words. My brain's a little fried at the moment too. So anyway, oh, and the doctor did say, like, in general, I'm tolerating everything really well, like the medications and the infusion and everything. You know, and he thinks we're gonna have good results. So that brings a little bit of peace of mind, but it's not gonna completely be there until they say it's gone. And even then, it's always gonna be in the back of my mind. It's gonna come back. So it's kind of a waiting game, you know, for the rest of my life. Yeah, I think that's it. I think that's everything. So I'll try to do other updates if there's any, you know, major happenings, developments with any of this. Otherwise, I guess that's it. I'm only going to say it once this time. Well, actually, that's not true. I said it a couple times already, but now I'm actually going to stop the video. Hope everybody's well, and again, I appreciate all the support that I'm getting from friends and family. It means a lot. It really does. So there's that. All right, another video coming soon. Thanks.